Welcome to the News at 10. I'm Jude Binkley. Hospital leaders across Idaho are sounding the alarm about potential service cuts and even closures as new federal legislation takes effect. Aspen Shumpert joins us in studio, who sat down with health leaders about how this big, beautiful bill is going to squeeze hospital budgets. Aspen?
Jude, the law will push more people into uninsured ranks, meaning hospitals will treat more patients who might not be able to afford their bills. Those health leaders say this comes at a time when some facilities are already operating on thin margins.
We estimate it will be about a $1.2 billion impact to the state of Idaho. And to the hospitals here.
The Idaho Hospital Association says changes are coming to the country's healthcare systems, with President Trump's big, beautiful bill signed into law earlier this month.
I can't remember a time where I have seen elected officials move so quickly with such emphasis and so much effort into moving people from the insured category to the uninsured category.
Including new federal limits for Medicaid and cuts to $1 trillion from Medicaid over the next 10 years.
We estimate there will be about 75,000 Idahoans who move into the ranks of uninsured as a result of this bill.
Tony Lawson, a spokesperson for the Idaho Hospital Association, says even if people are not insured, they will still seek care.
You can't suddenly put 75,000 people into the ranks of the uninsured and think that won't have an impact. Whether you're insured or not, you still get sick. And so what we'll see are people who don't have access to primary care, preventative care, whose condition will worsen to the point that they seek care in an emergency room.
She says that will be a hit to hospitals' budgets, and the ones in rural Idaho communities could feel it harder.
Our smaller hospitals really operate with little or no margin, and so just adding a few cases, if you have one trauma, one big case that comes into your hospital that's very expensive from an uninsured patient who can't afford to pay, that could really have a dramatic impact on a small hospital budget in just 1 year.
Leading some hospitals to be forced to cut down services.
I don't mean to be crass, but in some cases, it's a question of life and death. It truly is. If you're live in a rural, remote community where the nearest hospital is hours away, if you lose your local hospital, that's life and death.
How would this affect Idaho's already large doctor shortage if hospitals were considering cuts or closures?
These days, physicians don't typically move into small rural communities without some support or employment from their local hospital. So we're already at 50th in the country. If we have a hospital closure, I mean, we can't get lower than 50th, but we certainly can get lower in our providers per 100,000 patients, which is.
Another way this law affects budgets is by blocking Idaho from accessing supplemental payments designed to help hospitals offset chronic underpayment from government programs like Medicaid. Idaho finds itself in a uniquely vulnerable position because the state just passed legislation to implement a program to do that, but hasn't implemented it yet, leaving us unable to meet the federal deadline to be grandfathered in for these payments. And Jude, Lawson says no Idaho hospitals have come forward just yet to say they are planning to close, but she says recent national reports say 8 hospitals in Idaho are at risk in closing in the next 7 to 8 years, 1 at risk for immediate closure.
All right. Thank you, Aspen.